Hi, John.
Hi, David.
What's your full name, John?
John Bennett.
And what's your position here at GCASA?
I'm the Director of Treatment Services.
What does that mean then? How many staff do you have under your jurisdiction, under your program?
Well, we operate 2 outpatient clinics and 4 satellite offices with about 35 staff altogether. 20 of them, 22 to 24 of them being clinical staff, and the remainder being support and other grants that we have.
Now, these staff are substance abuse counseling professionals for the most part, right?
Yes. Yeah.
So, like, what kind of degrees and credentials do they have?
Actually, the majority of the staff have a bachelor's or higher. I'd say probably a third of the staff have a master's degree. I have licensed social workers, licensed mental health counselors, licensed art therapists, and most of the staff are also CASACs, which is a certified substance abuse counselor.
Yeah. Now, these folks get supervision?
Yes, they do. Supervision is a big part of our program here.
And I know this is kind of a passion of yours, right? Can you describe for us a little bit what you've been doing, not only locally here at GCASA, but also at a state level in regards to clinical supervision for substance abuse counselors?
Sure. I am, as well as my position at GCASA, I'm a contract employee for the Office of Alcoholism and Substance Abuse Services, providing technical assistance and clinical supervision for other programs around the state. And I'm currently working with Steuben County Council on Alcoholism, and we have kind of revamped their clinical supervision model.
So what does that entail, a clinical supervision model? What would be the components of it, for folks who are watching this video and don't know anything at all about what clinical supervision is? Can you just kind of give a layman's description of what that might involve?
Sure. Let me backtrack a little bit, because everyone, one of the things we found across the state was that every program was at a different level or a different place in clinical supervision. So we kind of took the stages of change model, and if you were in kind of pre-contemplation or contemplation, we kind of took baby steps. So some agencies they didn't even have regular time scheduled with their supervisors. So in those agencies, we just encouraged them to at least monthly, or however often they could, meet with their clinical staff on a regular basis. Some agencies, I think, were more sophisticated. They had already kind of adopted a regular model of supervision. And so for those, we took a look at the differences between administrative supervision and clinical supervision. And administrative supervision would be the things that, your utilization and quality assurance would take care of. You're making sure that all your I's are dotted and your T's are crossed and your treatment plans are signed and your paperwork and documentation's in good order, and that, you have adequate staff to meet the needs of the clients. Clinical supervision really is more about the process that goes on between the counselor and the patient. And it's more about the transference and countertransference that might occur, taking a look at your own skill level, how comfortable you are working with certain clients. It's a dynamic, I think, that the parallel process is for a clinical supervisor to meet, for a director, my position, to meet with my clinical supervisors, provide them with some direct observation and coaching around their clinical skills and their confidence and working with clients they work with. So, that's kind of in a nutshell. But clinical supervision, I believe that it's a strong model of clinical supervision includes direct observation, includes regular meetings, includes group, having case conferences with multidisciplinary teams, so it involves lots of different disciplines. There is, I also sit on the Credentialing Application Board, and the most recent CASAC exam, Finger Lakes in Western New York scored 83%. That was the pass rate. New York City scored a pass rate of 42%, and the average in New York State was 53%. The international average for the test was 71%, so you can see that we were 12% above the international average. They say that, OASIS has hypothesized that They believe that in this region, clinical supervision is taken more seriously and provided on a more regular basis, as well as we have 3 teaching universities around here that we can gather our qualified staff from.
Well, plus we're smarter and more competent here in Western New York and the Finger Lakes region than they are in other parts of New York State, wouldn't you say?
You know, I didn't want to say that, but I think that's what it comes down to.
Yeah.
Yeah, so
Well, you know, it costs a lot of money to provide clinical supervision, right? I mean, clinical supervisor could be seeing clients and getting reimbursed for their time, and instead they're working with other staff to do it. So what are the benefits, would you say, to an agency in providing clinical supervision?
for my staff, one of the benefits is that job satisfaction and you know, job enhancement. I think agencies that don't provide it, they're going to have high turnover rates, you're going to have high burnout rates. I can even see it here sometimes when I miss supervision, you know, for 3 or 4 times in a row because I have meetings or something. You know, my staff start to complain that, you know, I need to meet with you, I haven't met with you in a month, I really need to sit down with you. So it's really about, I think, employee wellness, job satisfaction, and, you know, there's a big push for talent management, retaining and keeping staff, and we have a very high retention rate at GCASA, and I believe part of it is because of how we treat our employees.
Right. Having a clinical supervisor, another colleague who acknowledges and recognizes the work that's being done, I think is very affirming and validating for an employee, don't you think?
And working for you is validating.
What do you like working for me, John? What's the best part of working for Dave Markham?
David, I have to tell you that working around the state, I know that I'm blessed working for somebody who allows his staff to use their creativity and their talents, and, you know, just the sky's the limit. You love it when things are going on in this agency that you don't even know, you know. You love it when people come back and say, hey, David, you know what we're doing? I'm out, you know, doing, oh, I've lost it.
That's right. Well, you know, you make it happen, though, John. I am really grateful for the leadership that you provide to our treatment services, and I think your interest in further providing and developing a good clinical supervisory model, not only at GCASA but across the state, is a very significant contribution to the substance abuse counseling field, as well as to the quality of services that agencies are able to provide. Anything else you want to share with our audience before we finish this video?
Just that I do not like to be on camera.
Well, you've done a terrific job, though, and knowing that, I'm especially grateful that you have agreed to give me this interview. Thanks so much, John.
You're welcome, David.
Bye.